Welcome to the Regional Plastic Surgery Center's presentation on carpal tunnel syndrome. Causes, signs and symptoms, when you should seek help, solution options.
Thank you for watching our presentation on carpal tunnel syndrome. My name is Dr. Denton Waddimal. I am a hand surgeon in the Dallas area. We wanted to speak to you today about some basics about carpal tunnel syndrome. First, what is carpal tunnel syndrome? Carpal tunnel syndrome is where there is a pinched nerve in the wrist that leads to the hand, causing pain, numbness, and tingling of the hand. What causes carpal tunnel syndrome? Anything that makes this tunnel too tight, too crowded, can increase the risk of carpal tunnel syndrome. We know that medical conditions such as obesity, diabetes, rheumatoid arthritis can all cause carpal tunnel syndrome. Fractures or ligament injuries around the wrist that cause wrist swelling or tumors in the wrist can all cause carpal tunnel syndrome. There are some people who have extremely high force job activities that cause wrist swelling. That can cause carpal tunnel syndrome. In short, anything that crowds this small tunnel can make carpal tunnel symptoms occur.
Hi, I'm Bruce Byrne. I'm a board-certified plastic surgeon and hand surgeon. I'm here to talk to you about the signs and symptoms of carpal tunnel. It's a syndrome about the median nerve where there's pressure at the wrist, and most people will feel numbness, tingling, pins and needles type sensation, even weakness, and sometimes pain. It usually starts in the fingers and sometimes in the palm, but it can radiate up in the forearm and up into the shoulder. Most of the time the symptoms are in these 3.5 fingers, because this is where the median nerve supplies. The ulnar nerve supplies this side, so it's a different nerve. So if it's in the small finger, it may not be carpal tunnel, or may be different or include that. The symptoms usually occur at night, but don't have to, and you can feel like you have to shake things out because the symptoms are burning and tingling. It may not prevent you from falling asleep, but it usually will wake you up and you have to shake it to feel better.
I'm Dr. Robert Kwan, and I'm here to talk a little bit about when you should seek help for carpal tunnel. You know, the trick is everyone gets the occasional ache or pain or bout of numbness, whether it's due to working out too hard or a minor injury. That doesn't necessarily mean you need to see a doctor. But in particular, if you have numbness, more so than pain that persists for more than a week or so, that's something that deserves to be treated. The issue with carpal tunnel is that it's generally not an emergency. You can afford to wait weeks or even months, and in general, no permanent long-term ill effects will occur. But the problem is people who ignore it for too long. At that point, the nerve actually starts to die, and you actually get, in addition to numbness, you can actually start to get weakness. People come to us unable to button their buttons. They drop small objects, they burn their fingertips on their coffee mug, and that's really what we want to prevent. We want to get people when they're just having that numbness every day, when they're driving their car, when they're waking up in the middle of the night, before they start to get some permanent nerve damage, and at a point where we can really get a fast and effective response with whatever treatment we choose to pursue. At this time, I'd like to introduce one of our patients, Vicki, who's going to explain a bit more about her experience with endoscopic carpal tunnel release.
I was diagnosed in 1999 with minimal carpal tunnel in both my right and my left hand. So I finally made the decision to get professional help, and I made an appointment here. The procedure went very well. I had no pain. It was a day surgery. Breckenridge was the surgery center here, and I just liked their people and the scheduling, and the nurses were a love. Everything went really, really well with all of that. It's a day procedure, and so you basically go through what you have scheduled, and then you're in recovery for a very short period of time, and then you go home. I'm starting to type, and I can turn my ignition key on, and I'm very happy with the progress. My fingers move, there's no more numbness. I've started typing again, even with my thumb.
Hi, I'm Dr. Josh Lemon. Thank you for joining us today. We've already kind of talked about what causes carpal tunnel syndrome, what the symptoms are, and what a patient with these symptoms would experience. when it comes to surgical treatment, people often ask us in our practice, what's the difference between the open carpal tunnel release and the endoscopic carpal tunnel release? And most studies would show that patients do great with both options in the long term, but the real benefit of the endoscopic carpal tunnel release is that people do so much better, so much faster. In fact, patients have been shown to have up to 50% quicker recovery compared to patients that have the open technique. The real benefit is that the incision that is made in endoscopic carpal tunnel release is not on the palm itself. Instead, it's over the wrist. So the dissection doesn't have to be as deep, and the length of the incision is not directly over where the pressure is placed on the palm in the postoperative period. So the way we handle it in this practice is the stitches are buried beneath the skin and a protective dressing is placed. The night of surgery, patients are encouraged to begin moving their wrist and their hand right away. And after 24 to 48 hours, the soft dressing can be removed. People can resume regular hygiene and washing of their hand and keep it covered only if necessary. At the end of 1 week, patients are encouraged to return to all their usual activities, and the vast majority of patients are able to return to normal work within a few days of surgery, and it is only when they have really heavy manual labor jobs that they need to be off work for longer than that. So that's the real benefit of the endoscopic technique, and why we do it here so frequently in order to get our patients the best care possible. Again, thank you very much for joining us.
Many people are able to return to work in as little as 2 weeks after surgery. If you need hand therapy, our certified hand therapists are in the same convenient Richardson location as our surgeons and surgical facility. At RPSC Hand Surgery Center, you will have the care of specialists all in one location. Our team of board-certified surgeons at the RPSC Hand Surgery Center offers safe, effective solutions for carpal tunnel syndrome with minimal downtime. Your doctor consultation, surgery, and rehabilitation are all on site at the RPSC Hand Surgery Center. We are ready to help you. Visit us at regionalhandsurgery.com or call 972-470-5000.